Hey, Meducate Hub fam, are you ready to level up your knowledge? The arrival of a newborn baby is a joyous occasion, often filled with anticipation and wonder. Amidst the excitement, healthcare professionals perform assessments to ensure the baby's well-being. One such assessment is the Ballard Scoring system, used to estimate a newborn's gestational age. This essay will delve into the intricacies of Ballard Scoring, explaining its purpose and significance.
Developed in the 1980s by Dr. Jean L. Ballard, it quickly became a reliable method for assessing gestational age. The Ballard Scoring system uses physical and neuromuscular criteria observable in newborns. This method helps healthcare providers make informed decisions, especially for premature babies.
Accurately determining a newborn's gestational age is crucial for providing appropriate care and anticipating potential health challenges. Premature babies born before 37 weeks of gestation often require specialized care and monitoring due to their underdeveloped organs and immune systems. Conversely, babies born later than expected, termed post-term, may face different risks, such as meconium aspiration or low blood sugar.
Knowing a baby's gestational age helps healthcare providers make informed decisions about feeding, monitoring vital signs, and providing necessary interventions. For instance, premature babies often require assistance with feeding and temperature regulation, while post-term babies may need their blood sugar levels closely monitored. Furthermore, understanding gestational age allows for accurate growth assessments and developmental monitoring.
Premature babies, for example, are typically smaller than their full-term counterparts and may reach developmental milestones at a slightly later age. By knowing the gestational age, healthcare providers can track their progress and provide appropriate interventions if needed. In essence, assessing gestational age is not merely a routine procedure, but a fundamental step in ensuring that each newborn receives the individualized care they need to thrive.
The Ballard Scoring system comprises two main components: physical maturity and neuromuscular maturity. Each component assesses specific characteristics of the newborn, with scores assigned based on the observed findings. The physical maturity assessment focuses on the development of the baby's skin, lanugo, plantar surface, breast, eyes and ears, and genitalia.
For instance, the skin texture of a premature baby is typically thin and translucent, while a full-term baby's skin is thicker and more opaque. Lanugo, which helps regulate body temperature in the womb, is more abundant in premature babies and gradually disappears as the baby approaches term.
The plantar surface also provides clues about gestational age, with creases developing gradually from the toes towards the heel as the baby matures. The breast bud size, ear cartilage development and genital development are also taken into consideration. Premature babies may have barely visible breast buds, soft ear cartilage that springs back slowly when folded, and less prominent genitalia development compared to full-term babies. By carefully evaluating these physical characteristics, healthcare providers can gain valuable insights into the baby's maturity level.
To illustrate how physical maturity is assessed using the Ballard Scoring system, let's consider a few examples. Imagine a baby born at 34 weeks of gestation. This baby's skin is likely to be thin and smooth, with visible veins.
In contrast, a baby born at 40 weeks will have thicker, more opaque skin with fewer visible veins. The plantar surface will have creases covering most of the sole.
The breast bud size will differ significantly between a premature and a full-term baby. These examples highlight the gradual progression of physical characteristics as a baby matures in the womb.
Section 5. Evaluating neuromuscular maturity.
In addition to physical maturity, the Ballard Scoring system also assesses neuromuscular maturity, which reflects the development of the baby's nervous system and muscle tone.
This component evaluates 6 different criteria: posture, square window, arm recoil, popliteal angle, scarf sign, and heel-to-ear maneuver.
Each criterion is scored based on the baby's response to specific maneuvers.
For instance, posture is assessed by observing the baby's preferred position when lying on their back. Premature babies tend to have more extended limbs, while full-term babies typically lie with their arms and legs more flexed.
Similarly, the scarf sign is assessed by gently pulling the baby's arm across their chest. Premature babies will have less resistance and their elbow will easily cross the midline, while full-term babies will have more muscle tone and their elbow will meet more resistance.
By evaluating these neuromuscular responses, healthcare providers can gain further insights into the baby's maturity level. Section 6. Illustrating neuromuscular maturity criteria.
To better understand how neuromuscular maturity is assessed, let's visualize some of the criteria.
Imagine gently flexing a premature baby's wrist towards their forearm. The angle formed at the wrist, known as the square window, will be quite large, indicating low muscle tone. In contrast, a full-term baby's wrist will have more resistance to flexion, resulting in a smaller square window angle.
Similarly, imagine holding a premature baby's arms flexed against their chest and then releasing them. The arms will spring back slowly, indicating low muscle tone. In a full-term baby, the arms will spring back quickly to a flexed position, demonstrating greater muscle tone.
These examples demonstrate how the Ballard scoring system utilizes simple yet effective maneuvers to assess neuromuscular maturity. By carefully observing the baby's responses, healthcare providers can obtain valuable information about their neurological development.
Section 7. Calculating and interpreting the Ballard score. Once all the physical and neuromuscular criteria have been assessed, the individual scores are added up to obtain a total Ballard score.
This score is then correlated with the gestational age in weeks, ranging from 20 weeks to 44 weeks.
For instance, a Ballard score of 10 corresponds to a gestational age of approximately 26 weeks, while a score of 40 corresponds to a gestational age of approximately 40 weeks.
It's important to note that the Ballard score provides an estimate of gestational age, not a definitive answer. Other factors, such as maternal health history and prenatal ultrasound findings, are also taken into consideration.
Furthermore, the accuracy of the Ballard score is highest when performed within the first 24 hours of life. After 24 hours, some of the physical characteristics, such as skin texture and lanugo, may start to change, potentially affecting the accuracy of the assessment.
Section 8. Benefits of the Ballard Scoring System. The Ballard Scoring System offers numerous benefits in neonatal care. Its standardized and objective approach reduces subjectivity in gestational age assessments, leading to more consistent and reliable results.
This is particularly important in settings where access to prenatal care or accurate maternal history may be limited.
Moreover, the Ballard score is a relatively quick and easy assessment to perform, requiring minimal equipment. This makes it an invaluable tool in resource-limited settings or emergency situations where rapid assessment is crucial.
The information obtained from the Ballard score aids healthcare providers in making informed decisions about a newborn's care, such as determining the need for respiratory support, intravenous fluids, or specialized feeding regimens.
By providing a more accurate estimate of gestational age, the Ballard scoring system contributes to improved outcomes for newborns, particularly those born prematurely or with potential complications. Section 9. Limitations and considerations. While the Ballard scoring system is a valuable tool, it's essential to acknowledge its limitations. As mentioned earlier, the accuracy of the score can be influenced by factors such as the timing of the assessment, the examiner's experience, and the presence of certain medical conditions.
For instance, babies exposed to certain medications in utero or those with congenital anomalies may exhibit physical or neuromuscular characteristics that do not align with their actual gestational age.
In such cases, healthcare providers must consider these factors and interpret the Ballard score in conjunction with other clinical findings.
Furthermore, it's crucial to remember that the Ballard score provides an estimate of gestational age, not a definitive answer. Other methods, such as prenatal ultrasound dating and maternal LMP, should also be considered to obtain a comprehensive understanding of the baby's maturity level.
Section 10. Conclusion. A valuable tool in newborn care. In conclusion, the Ballard Scoring System remains an indispensable tool in neonatal care, providing a standardized and relatively accurate method for assessing gestational age.
By evaluating a combination of physical and neuromuscular characteristics, healthcare providers can gain valuable insights into a newborn's maturity level, enabling them to make informed decisions regarding their care.
While the Ballard score has its limitations, its widespread use and ongoing refinements continue to contribute to improved outcomes for newborns worldwide.
As we strive to provide the best possible care for our tiniest patients, the Ballard Scoring System will undoubtedly remain an essential part of our toolkit. Pause 3. Section 11. Practical application in clinical settings.
In this chapter, we will provide a clear and detailed explanation of both physical and neuromuscular maturity. We will cover the key criteria used to assess these aspects, including examples and illustrations to ensure a comprehensive understanding. To begin, let's revisit the physical maturity criteria. These include skin texture, lanugo, plantar surface creases, breast tissue, eye-ear development, and genitalia. Each of these characteristics offers insights into the newborn's development and can be visually and tactilely assessed by healthcare providers.
Next, we will delve into neuromuscular maturity. This involves examining posture, square window, arm recoil, popliteal angle, scarf sign, and heel-to-ear maneuver. These criteria help determine the neuromuscular development and reflexes of the newborn, providing a more complete picture of their overall maturity.
Through detailed examples and illustrations, we will demonstrate how to accurately assess these criteria in a clinical setting. This practical application will reinforce the theoretical knowledge covered in previous sections, ensuring that healthcare providers can confidently utilize the Ballard Scoring System in their practice. By mastering both physical and neuromuscular maturity assessments, healthcare providers can improve the accuracy of gestational age determination, leading to better informed decisions and ultimately enhanced care for newborns. Stay tuned as we explore these essential aspects in greater detail, helping you to become proficient in the practical application of the Ballard Scoring System. Respire, relax, and react. Like this video, share with friends, comment with questions, and subscribe for fresh insights.